Thanks for your wise words. I was actually looking at your books to see what's at the back, and I saw the Sun newspaper there. I didn't know what's going on, Steve. I'm concerned. I don't know what that orange book's about either, Steve. We'll pick that up offline.
I'm going to get you some new glasses, Anthony.
Thank you very much, Steve. I don't know if Croydon's got any money for that at the moment, but we'll pick that up offline. Well, I'm a troublemaker, ladies and gents. I really want to thank you for your patience. Thanks for your words again, Steve. The next person we're going to introduce, ladies and gents, is Counsellor Janet Campbell. Thank you so much, Janet. We're really glad you're with us. We look forward to some of the words you're going to share.
Thank you, Anthony, and it's really great to have this opportunity to address
Doctor.
Thank you very much. I'll just hand over to Anthony here.
All right, I want to thank everybody for their patience, and I'm really grateful for Doctor for just sharing her words of wisdom and recommendations. I'm going to try and ask the cameramen to come over to the crowd now, to the panel, because right now we've got 4 doctors in the room, and in this room we've got tremendous talented doctors who have been working extremely well in the fight against COVID. They've come with advice, recommendations, they're coming with knowledge, wisdom, understanding. And I've also got the Reverend Damien Luke, who is the head of TCC Churches Together in Croydon, and he will be speaking from a faith perspective. And I'm going to let everybody introduce themselves. They'll have about 30 seconds to introduce themselves, tell them who they are and what experience they have in relation to this matter. Then I'll hand over to Stella, who's got questions that have already been sent in. We are looking at the chat as well to get questions that we will ask to the panelists, and hopefully many of your questions will be answered. So can I ask the camera to start with the distinguished gentleman on my far side? That's the Reverend Damien Luke. So if the camera can just focus on him slightly, I'd be so grateful. Thank you. He's, yeah. I think we're live with Pastor Damien Luke. Pastor Damien Luke, welcome to this tremendous forum. We can see you, they can see you. Can you tell us a bit about yourself, please, for the next 30 seconds?
I'm Damien Luke. I lead Praise House in Croydon. I'm also current chair of the Croydon Churches Forum, as well as leader of Together Croydon Churches. And I'm here because I'm passionate about the welfare of our BME community and to make sure that we get the right information. So, that's me.
Sorry, I've just been informed that you didn't even get to see him. So we're going to try and get that camera just to glimpse him again. So this is the modern world that we're in at the moment. So thank you for being patient with us. Pastor Damien, wave at them. Now they can see you. Can you turn your phone on mute, Pastor? Because we're getting an echo.
It's not coming from me.
Okay. Sorry, by your accent, I didn't know if you had Labara Mobile.
No, I have Nokia.
Can we go to Dr. John? Dr. John,
Yeah.
tell us about yourself, where you're based.
My name is John Afalayan. I'm a surgeon in the NHS, specifically in North London. I'm also quite active in my community. I'm one of the leaders in my local church, Great Light Church, which is based in East London. I've been working with a group of medics called 5-2 Medics, and really in this period of pandemic we've spent quite a bit of time reaching out to black community members, trying to engage them in terms of their health, trying to inform and educate them, and we're doing quite a lot of work currently to try to talk about issues surrounding the vaccine.
Thank you. Marlene Johnson. What a privilege to have you here, Marlene. We've been trying to book you for how long? Good to have you, Marlene. Tell us a bit about yourself.
So, hi everyone. My name is Marlene Johnson. I'm head of nursing at St George's Hospital, which is based in Tooting, and I'm here to hopefully give you some very informed, accurate information about the vaccine, and to tell you why I think it's important that you should certainly consider having the vaccine, talking to your families, talking to your friends, and having informed information that will help you to do that.
Thank you. And last but not least, I get you to do it as a husband and wife couple, because the 500 viewers are wondering, you're sitting together, there's no social distancing, but they're husband and wife. So I'll let you introduce yourselves. Thank you.
Okay. I'm Dr. Daniel Osigbe. I'm a GP in Streatham, and hopefully we can help to answer some of your questions.
You're born and raised in Thornton Heath, right? Or you're from Thornton Heath?
From Thornton Heath, yeah.
Thank you. There's hope. Dr. Groom.
My name is Dr. Noor. I'm a GP. I work in Lambeth. I've worked over South London for many years. Beyond the COVID vaccine, I just want people to know that if you are unwell, it's really important to seek help, and feel free to ask any questions. We will answer what we can.
Thank you. Stella, what are the questions?
Brilliant. Thank you very much, everyone. Thank you for joining us. I'll just ask my colleagues in the chat if you could share the link to the Mentimeter. Anybody that has questions, you can pop this on the Mentimeter link and it will show up live and direct with the doctors. We do have pre-prepared questions which people sent in ahead of time. If I can ask my colleagues once again to just share the link in the chat and then we'll get going. So I'll first ask the pre-sent questions and then I will ask some of the live questions. Thank you very much. So one of the questions that came through prior to the event, just before we began, was how long has the RNA vaccine been in extensive use in the world population? Has there been any recorded side effects that are under investigation?
I'll go straight to Dr. Daniel Osigwe.
So if I just get a question first, how long has it been in use? Is that correct?
That's right.
Okay, so in terms of, I think it's just what we've heard of, and it depends what vaccine you're referring to. So there is the Pfizer vaccine, which is an mRNA vaccine, and there's also the Moderna vaccine, which has been approved. And we started vaccinating in the population in December. But the studies have been ongoing since around about March, April time. So we've got the trial information from that. So we've got the trial data from that. But in terms of from being in use in the community, it's since December.
Does that answer the question?
I believe so. Has there been any recorded side effects that are under investigation, was the second part of the question.
Okay, sorry, I forgot about that part. But in terms of the side effects, they're well known, and in terms of, if you look at the product information, the side effects are the common things such as pain at the injection site, fever, and so very common side effects to do with vaccinations. In terms of, there are no uncommon side effects that are currently under investigations. There obviously, people might know there was something in the news about something that happened in Norway with the vaccinations and with some patients in a care home. Well, that's under investigation, but not in particular to the mRNA vaccine itself.
Thank you very much. Okay. Next question. Does a person who has the COVID-19 virus build immunity against it? If so, why do they still need a vaccine?
Dr. John.
So, the truth about COVID-19 is that there's still a lot of unknowns, and we are effectively learning on the job. So, when it comes to so-called your own immunity and you building it yourself, we really don't know currently how long that will last for in terms of the antibodies that you produce naturally. That's why it's still recommended that despite the fact that some people may have had COVID and may have developed antibodies themselves, it's still recommended that they have the vaccination, because that right now is the only thing that has been tested with some science, and we can't really take chances by telling you not to take it.
Thank you. Okay. Next question. When one gets vaccinated, e.g. against polio, measles, etc., one can never be a carrier of the virus. But strangely enough, with this vaccine, one can still be a carrier and therefore pass on the virus to another. Does this not totally defeat the whole sense of having the jab, especially now that there are various variations?
Dr. Daniel.
I'll answer that. So I think that information is not totally accurate. So with other vaccines, you can be a carrier of the infection even though you've been vaccinated. So even with the flu vaccine and certainly with polio vaccine, so you can be a carrier. In terms of there's two ways in which the vaccines work. So there's a certain percentage of people that will not get the infection at all. So those are people that will not be carriers. And there's a certain percentage of people that can get the infection, but because of the vaccine, they're not going to become infected. So they might be carriers as if you tested them for it. And lots of vaccines work in this way. So they suppress the ability of people to get the virus, but also even if they do get the virus or the pathogen, that's an infective agent, it also reduces the ability for them to get the disease, if that makes any sense, I hope.
Yeah, so we have to remember that the main point of the vaccine is to help you, the individual. So it's not so much about reducing transmission, although there's research ongoing about that. It's about if you get the illness, that your body's able to effectively fight it so that you don't have side effects that land you in hospital or land you being dead. And that's what we're trying to prevent. We're trying to prevent death and serious illness. That's the point of the vaccine.
Thank you very much. If there is no conclusive scientific data to suggest that the vaccines will not prevent transmission, why do they not clearly state this up front? And in doing so, then clearly state the justification for rolling the vaccine out along with a message that is in the path back to normality, i.e. no more masks, no more social distancing measures.
Hi. So I don't think we're saying that if you take the vaccine that you won't get COVID. I don't think that's what we're saying, and I don't think there's ever been a message out there saying that if you have the vaccine you won't contract COVID. What we are saying is that the vaccine, once you've had the vaccine, that hopefully will reduce the risk of getting what we would call serious COVID, which yes, inevitably can be in hospital. You can end up in ITU on a ventilator, and you can become seriously unwell. So the idea of having the vaccine is not that it's going to totally exclude you getting COVID, and I don't think there's ever been any evidence that stating the vaccine will not give you, will stop you getting COVID. So I think it's, the information that you're receiving, it's how you're interpreting that information. The vaccine at the moment is to stop you getting the serious symptoms that you would get with what we call serious COVID. So a lot of patients who are in hospitals, who are in ITU or on ventilators, who've got underlying serious medical conditions, who've contracted COVID, having the vaccine is to try and prevent some of those patients who would normally end up in hospital, ending up in a hospital bed.
And I think maybe there's a problem also with mixed messaging. So I listen to the radio a lot, and you hear a lot of presenters presenting a controversial case of that if you work in a certain environment, for example in health, that if you don't have the vaccine that you shouldn't work, because if you've got the vaccine you're going to prevent transmission. So actually I think some of that idea that the main thing about this is about preventing transmission is about mixed messaging. Some from media sources, this is about protecting you until there's further evidence to prove otherwise.
If I just add as well, so like for some of the vaccines, like the Oxford vaccine, there is some evidence that it does prevent transmission, but that study is ongoing, and in terms of for the other vaccines, the studies are still ongoing to see if they prevent transmission. There is hope that we believe that there will be some degree of prevention of transmission, but that's still ongoing. So I think that's what I'll say, it's still ongoing, it's not conclusive yet.
Thank you very much.
Stella?
Yes, Anthony.
Sorry, can I just throw the question out, because whilst there's still ongoing checks going on and balances, I think that's where some of the community are concerned, because there's still checks going on. So whilst we're encouraging everyone, or it's being said, take the vaccine, it's because there's still checks and balances and things going on. I think it's that part that's causing the community concerns, because there's nothing conclusive other than checks and balances. Who wants to take that?
So I think it's right that, whilst the vaccine's been rolled out, that research is still taking place. So we know, for instance, that the vaccine was not trialled on pregnant women, but we know now that as more people are taking the vaccine, there will be pregnant women further down the line who will have had the vaccine. So therefore you have to continue studying, because science doesn't stand still. And I know that even in my hospital, we are doing studies on staff and on patients who've had the vaccine, because you still want to see where the efficacy is and how long that efficacy is going to last. So you do have to have continued research. You can't just say, we have a vaccine, we've done the research and stop at that point. You have to do further research. You have to look at, I'm sure many of you've seen, there are variants that are coming up in the community. So you have to look at those variants in relation to the vaccines that are available. So absolutely there has to be continued research.
It's probably also worth adding to that when it comes to what we are certain about and what we're not certain about, we are certain about the science from our point of view. So is this an effective means of getting a serious variant of COVID that may potentially kill you? I don't think anyone can argue that anyone that could read a scientific paper. So that area is not uncertain. When it comes to issues to do with long term and what can happen, there are some grey areas, and we're just being honest about that. But in terms of how it affects you, how it affects your loved ones on a personal level, is this the safest thing that we have right now as a means of getting us out of this particular situation that the whole world is in? 100% yes.
Sorry, we're just picking up our hum.
There's quite a bit of feedback. If there are any devices on near any laptops in the other room, please can we keep them away? Thank you very much. Thank you for answering those questions. Did anybody else want to respond before we move to the next one? Okay. Why are there conflicting reports on the efficacy of the vaccine on new strains, e.g. the South African variant or E484K mutations?
I'm not sure if there are conflicting reports. I think it's probably you might have to substantiate that in terms of what are the conflicting reports. I think from what I know, I would say yes, in terms of with what's been found is that the AstraZeneca vaccine is not as efficacious against the South African strain as it is against the first variant, which we've had, which is spread all over the world. So there's different efficacy with the different variants, with different vaccines as well. And so different vaccines, whether it's the Pfizer or the AstraZeneca, can have different efficacy against the different variants. But I think this is also something that's ongoing, that we're not making this up as we're going along, we're actually studying the efficacy. And the information that's come out of South Africa is based on a very small study of 2,000 people. From a scientific point of view, that's a very small level of evidence that needs to be looked at by experts, and also bigger studies need to be done as well. So I think it's an evolving area, but I don't think there's any conflicts at the moment. There are lots of information that will come out of it, and it might change as the numbers that are studied get bigger. So that efficacy might change as well.
And we have to bear in mind that everything that we're hearing is live. So usually when we get, like for example, I don't know, paracetamol, if you heard about the live reports about how it was affecting people in, I don't know, different nations and different countries, you will get different results. So we're hearing everything live, so you're hearing everything the scientists are, so things will vary, and further down the line we may hear of variations because of, I don't know, different climates or different conditions, but this is live information and you're getting it the same way we are, and further interpretations are yet to be made.
And I think I would just also like to add to that. I think, even with the flu vaccine, each year the flu vaccine does vary in terms of how it's produced and what it covers. So, having a vaccine that doesn't absolutely cover all variants in one hit is not usual. I think that's to be expected.
Thank you very much. If the vaccines cannot be effective against existing known variants, how can the vaccine be the way back to normality? That's another question that's come through.
I don't think that's factually accurate, I'm sorry. And I think one of the things we're really passionate about is getting the right information across. So that statement, I'm sorry, is contrary actually to a significant body of evidence. What we're saying is that the common variants that we're aware of, certainly from when we became aware of the disease, the vaccines that we have are efficacious. That's what they work for. It's some of the newer variants, like with any new thing, that needs to be tested. So I think we also need to fact check some of these statements and make sure that we are saying the right thing.
But I can understand why people would say that, because, for example, we know that some vaccines aren't effective against certain strains in certain countries, but that won't be relevant to where you are. So I think we just have to be, wary about how we're mixing information which is relevant to different countries and different settings as well.
Thank you very much. I'm just going to hand over to Anthony to ask the next set of pre-sent questions before we move over to the live. Thank you very much.
Hi all, we've got some questions that have been posed here, and I'm going to put in a couple of questions that I've got off the road in West Croydon today, because I had to ask some local people in Croydon from the man who sold me a patty this afternoon. So one of the questions was asked to Pastor Damien Luke. The question is asked, is this 666 related?
I think for those who don't understand what 666 is about, it's just a Christian understanding that the world will come to an end, and before the world comes to that end, there are a few events that will take place. The problem is that nobody knows, and it's one of those questions that no one ever has a correct answer to. And every time the church or the world has faced one issue or the other, people will quickly jump to a conclusion that this is 666. So it's not the first time that the story of the issue of 666 has come up. If you ask me a direct question, is this 666? My answer would be, without any reservations whatsoever, that this whole pandemic is not 666. There are signs and there are events that would occur before the end time that we're not seeing. But people are quick to jump to a conclusion that this is 666. But from where I sit, and from my own understanding, and from also having spoken to colleagues, this is nowhere near 666.
The next question is, so why is it that so many church people and faith-based organizations, why do they not want to be vaccinated? What is the myth around it? Is it because they believe it's end-time prophecy? Is it because, some pastors are telling their members, only believe in the blood of Jesus? What is the challenge around this?
Different pastors will teach different things, but at the end of the day, I'm a Christian, and I have a duty of care to ensure that I spend time to study, not just to study scriptures, but also to study the world that I live in and to ask questions. I'm sitting here in a panel with medical people who I trust, who I know are not going to come back and give me wrong advice, and therefore pastors can sometimes also project their own personal fears to their congregation. To tell your congregation to always do as you say, in my view, is a measure of control, because at the end of the day, we need to focus on the Word of God, but also allow the people to go home and test what they've heard. And I think that even if a pastor is saying such a thing, the individuals concerned must go home and do their own personal studies.
Very good answer, Pastor Damien. Very good answer. The next question goes out, and I'll put it to John. The vaccine has caused so many well-qualified doctors in America to lose their job, as they voice their real truth about the long-term damage this vaccine can have on the population, especially on the people of colour, in the population due to their DNA. Why do you think you can change our minds when we have been enlightened well before the vaccine was made available?
So, first of all, I'm not trying to change anyone's mind, or we certainly here are not trying to force anyone to do anything that they don't want to do. We live in an amazing time and age in which there's information, and we all have access to this information. The only thing that requires some caution is where we get this information from. So all I will say is, when you get a certain bit of information, you also have to look at the motive, or look at the message, and look at the reason and rationale behind why someone is saying certain things. Now, you mentioned that there are lots of doctors in America that have lost their jobs over this. That may well be the case. I think COVID has created a tremendous opportunity in medicine, in industry, in technology, in science, for people to, be relevant and to make some sort of name for themselves And I think some of those things also are at play. So do I think that we have one or two doctors that are really, really telling the truth, and the entire medical community is trying to lie to everyone else? No, I don't think that's what we're dealing with. But I think with anything, and this is why medicine, as much as it's a science, we talk about the arts of medicine, that there are still some things that are unknown, and there are still some things that are subjective, and you're always bound to have a difference of opinion. But when it comes to the issue of COVID and vaccination, the science is leading in one very clear direction.
I've just had a message sent to me, and the message was that at home we boil herbs, ginger, lemon and thyme and garlic. What's wrong with using that instead of the vaccination? I'll go to Marlene.
So you know what, I'm going to keep it real. So there's nothing at all wrong with your local remedies at home. If you have a cold, if you have a sore throat, you know, we all know, you know, it's the garlic, it's the rum. Did I say rum? You know, it's what works for you, and there's absolutely nothing wrong with that. I myself do all of those remedies, and that's absolutely fine. But those are remedies that's going to help a cold, it's going to help, you know, headache, it's going to help upset stomach. You know, we are dealing with a virus that, as we know, is out there in the community, and people are dying from that virus. So therefore, this is not the same as treating a local cold at home. And for some people, I know that they've had symptoms, they said they've taken those things and the symptoms have gone away. Well, that may well be, and I'm not disputing that. I'm not here to say that that isn't the case for some people, but that's not the same for everyone. And if you look at the population, if you look at people in hospital, if you look at people who, you know, died, you know, those people have died because there is a pandemic and there is a virus out there that unfortunately does not respond to the garlic, the rum, the ginger, the thyme, the turmeric, and whatever else you want to put in there. So I think it's about, you know, looking after yourselves, taking some of those things if you feel that that's going to help and soothe some of the symptoms you may have. But if you've got serious symptoms, if you've got breathlessness, you know, if you've got the real myalgia that comes with COVID, unfortunately, no amount of garlic, honey and thyme is actually going to resolve those symptoms for you.
Okay.
Can I just add to that?
Yes.
Can I just say that when people take some of these remedies and vouch that it's those remedies that have helped them, we should also remember that there are people who have recovered completely from COVID without taking any remedies. So are they going to now go away and say, well, don't take anything and you'll recover? I believe that all these things play a major role in helping people feel good about themselves and feel good about recovering. But we can't put it down to, I'm a Nigerian and I could swear by pepper soup that it kills everything. And everybody who knows me knows that every time I take it, I want pepper soup. And then, does it cure anything? No, it doesn't, but it helps me.
We're Jamaican, rum kills everything.
We're nephews.
Good points. I'm coming to a couple of ones here. I'm going to throw one in, another one that I heard in West Croydon, and then come back to the paper. Somebody says that because it hasn't been tested, is it true that you're going to get a tail? So no, because these are the myths that are out there, that you're going to get a tail, that it's going to cause women not to have children, that it's going to cause ED, erectile dysfunctions. Is all these myths true? Dr. Kuru, Dr. Daniel.
Oh, well, I'd say for definitely, like, the people that think that it's going to change their physical appearance, it's not going to be so, because this doesn't affect your DNA. So for you to be able to grow a tail, there would have to be something that genetically codes inside your body to say, grow a tail. Or like my brother-in-law told me, he's looking for my third ear. But these things are not going to happen. In truth, there may be long-term side effects from the vaccine that we don't know about, but generally speaking, when people have vaccinations, the problems are the short-term, so the fever, the feeling unwell, the flu-like symptoms, those are the things that people get from vaccinations. So from what I can see, we're not going to grow a tail, but we may have some other conditions that that may occur from this, but that's why we've still got the checks and balances that continue to go on to make sure that it remains as safe as possible.
I think I'll add to that. I think the first statement, I'm just going to basically confirm that statement and say that's not true. The first thing is that what we've been saying from the beginning is that this has been extensively tested. We've got over 100,000 participants in studies in which all these vaccines have been tested. So we know that it's completely safe, and even as we've been continuing the study and following our people, following vaccinations, we're finding that it's even safer than we thought. We know it's safe, and also we know it's very effective. So they've all been studied, and it doesn't affect fertility, doesn't interfere with your DNA at all, contrary to the myths that are out there.
And I just want to add that, in terms of the initial research, there was, over 43,000 people in the research, and of that, 42% were from diverse communities, which included Black, Hispanic, Chinese. Research was conducted in South Africa and Turkey. So, if you look at that extensive research, and research is still going on, then, when people start saying that this vaccine is going to change your makeup and it's going to affect you, and, people are going around saying it's making you twitch, you're going to grow a third ear, you're going to end up with an extra eye. These things are just scaremongering. They really are scaremongering. And I think that people putting that out there, I'm going to be honest, should quite frankly be ashamed of themselves.
Thank you, Doctor. Strong words. I've got two more, and then we've got the audience who've got questions. Those that are online have got questions. I want to also thank the doctors online who are responding at such a quick rate. The next question is there any conclusive scientific data to show that Black people are more susceptible to contracting the virus or more biologically prone to serious symptoms of the virus to need hospitalisation? Is the relation to high numbers of Black people more explained by the sectors they work in? I think you did touch on that earlier, but is there any elaboration? Do you want to extend on that?
I would say it's interesting the way the questions are phrased, but I think personally, I think that's an excellent question. I don't think there's any scientific data that points to Black people genetically being more susceptible to the virus. In terms, I think generally the evidence so far is looking more at things about medical comorbidities, so that the medical conditions that people have, the diabetes, the hypertension, all the things that are more common in our group of people, and also the socio-economic situations in which we live. More likely, like someone mentioned earlier, likely to be the cleaner, the nurse, the person right at the front, even if the doctor were right at the front of the action as well, and with the people that can't take time off work. And so we're more exposed, and I think those are the more significant reasons why we are disproportionately more affected. But also we have to think about also the fact that the conspiracy theories as well in our communities as well. That's my question to the community, to the audience. Is that a reason as well why we're hesitant to first of all believe? I remember in the beginning people telling me, Black people don't get COVID in the beginning. So then that changed from, we don't need the vaccine is whatever, and we have to really confront the issues that affect the way we seek medical help and view medical problems.
Okay, let me push to this one. Is it true that the government have indemnified vaccine manufacturers against any liability for harm done to persons as a result of taking the vaccine? If so, is this unprecedented, and why have they done so?
So I came across this, and I must say, when I did, because initially I refuted that was the case, but I think there were certain instances in which certain leeways were given to drug companies just to allow the rapid production of the vaccines. So I think we have to be honest about that, and I think, to be honest, as doctors and healthcare workers, we're part of the health users. When you talk about big pharmaceutical corporations and how they work, there are lots of nuances that we won't necessarily understand. But what I can say is that knowing medicine like we know medicine, there's no way in which a government can remove a pharmaceutical company from the responsibility of something that they're producing, something that is supposed to be tested properly and given to people. So irrespective of the scaremongering that you've read out there, there's no way in which a company will be allowed to give a medication and not be responsible for what they're giving people, especially if they've claimed to test it robustly. So I've come across some of those things a lot, but I'm not too sure how substantiated they are. I think some of those areas, to be honest, they're a little bit grey. And if some of those practices are true, then my own personal opinion also is that makes me a little bit uncomfortable.
Okay. We've got one from the crowd, from those viewers. Is it likely the vaccine will be like the flu vaccine and be an annual event for everyone in the UK?
Well, they're already talking about we may be needing a top up in the autumn because of the different variants. So yeah, it is likely. It's not unusual to need a repeat vaccination. The community will get what's needed.
And I think also just to add to that is to just think about in terms of we don't know how the current pandemic is going to evolve. We don't know if basically further mutations will lead to the virus becoming weaker, and so we don't know what's going to look like in 2 to 5 years time. The virus might die out, the virus might become like the flu, but we don't know yet. So we don't know. I think it's all a work in progress, and we're all in this together.
And I think that's the other reason that we need to continue to do research, because at this stage we don't know the full efficacy, we don't know how long immunity will last when you do get immunity. So I think it's important that we keep an open mind, and if it's deemed that we need to have a top-up vaccine in the autumn, that's the right thing for us, then I think absolutely that's we need to do that.
Somebody just put in the group chat that is it true that it will last in your system for only 192 days?
That's not true. It's like I think it's very specific, and I think it's like I don't know how it's possible for you to get your facts before the event has taken place. So I find it very difficult to believe. So in terms of natural immunity, we know on average lasts about 6 months from when someone has an infection. But in terms of with the science, we believe that the immunity you get from the vaccine would actually be longer. And just to add to that as well, like that's one of the reasons why we also recommend that even if you've been infected, you get the vaccine, because that's most likely also going to prolong your immunity for much longer as well.
I've just seen a real, I'll throw it out there because I'm looking at the chat, and some of the chat are coming out. Somebody said, can we have a balanced discussion on this? Somebody's asking how long does immunity last? I throw out to the panel this question. It's clear that there's a lot of mistrust and distrust in the NHS. What assurances potentially do you give those that are watching that they're to trust this process, trust the vaccine? Because I'm watching people and they're putting chats in and there's still a slight hesitancy. But what assurances do you think you can give from your professional opinion that these concerns they're hearing from conspiracy theories, from the churches as well, what assurances can you give medical team?
But I think it's difficult. It's going to be difficult to give an assurance right now, because I think what it highlights to me is that the mistrust didn't start with the COVID vaccine. The mistrust was already there. This was just a platform to be able to express your feelings about health concerns. So I can only tell you that as a GP, I go to work and I don't go to work with the intention of harming anyone, of killing anyone, of giving the wrong information, of encouraging you to take a vaccine that's going to give you a tail, of making you infertile, giving you erectile problems. That is not our aim when we go to work. We have studied, we've gone through a process, we continue to study. So whenever, we're always talking about excellence, how we're going to improve, how we're going to give the best to our community. So as a black doctor, I've come home from work now and I'm someone's daughter, I'm someone's wife, I'm a colleague, we are humans, so we are the same people who are going to be receiving the same healthcare that you do. I don't get special treatment because I'm an NHS doctor. I've got an appointment coming up next week with the hospital. I had to wait the same way as everyone else. So the only reassurance or assurance that I can give you is that I am in this the same way you are. I am not exempt from side effects, from whatever it might be that you are concerned about. But my concern is that people would take information and misshape it, and that it would affect their care negatively. My concern is that people would have worries I would bring it to the wrong platform. We just want you to make an informed decision. This is life and death. Nothing like this has happened before, and that's the only reason that we care about coming to you. So our assurance is that we are genuine about what we do, but we are just like you. We're patients, just like you. We're going to feel everything the same way you do.
And I think I would just want to add to that, as a nurse working in the NHS and seeing patients coming in, incredibly sick patients, you know, I'm not just talking about patients coming in with COVID, you know, I'm still treating patients who've got cancer, I'm still treating patients who've got kidney disease, who've got sickle cell, and for me it's important that when those patients come in, they get the same level of treatment that patients who have COVID get those treatments, and that, you know, they need to come in and feel safe in a hospital environment. They need to know that when they come in to a hospital, you know, they're going to get the very best of care. So for me, this isn't just around saying, you know, if I've got COVID or what's happening with COVID. You know, this is about general healthcare. This is around, you know, giving care to everybody who needs care, whether you have COVID, whether you have cancer, whether you've had a heart attack, whether you've had a stroke, you still need care. And I believe that the NHS provides excellent care for everybody at the point of care. So it's, you know, for people to believe that, you know, there's a conspiracy, that, you know, we're either treating one set of people, not treating the other, and that there isn't parity in terms of the treatment that people are receiving. You know, I think, you know, as Dr. Corey said, you know, if I become unwell and I go into hospital, I'm going to get exactly the same treatment that you're going to receive. The only difference may be, because I know the doctors and nurses, yes, I may get through A&E a little bit quicker, but I would still be in that same bed receiving the same treatment from the same staff.
I think
One second, I've been directed, I need to go to Stella, and then we'll come over to you guys because there's more questions that Stella's been given from the live chat. Doctors, just have a sip of the water because we'll come to you, Pastor Damien, in a second. Thanks, Stella.
Hi, thank you very much. Thank you. We're just going to go to the questions that have come in live. Can everyone see me? I will just share my screen. Can I just ask everybody please to mute themselves? Thank you very much. Can you see my screen? Can you see my screen? Fantastic, okay. Thank you very much. So we're just going to go to the questions that have been popped in the Menti live and direct. So this question I believe has been answered, so I'll just move to the next one. Is it likely this vaccine will be like the flu vaccine and be an annual event for everyone in the UK?
Yeah, it's possible that it will be a regular event.
Sorry, I can't hear.
Can you hear us now?
Dr. John, can you take that?
They can't hear us.
They can't hear us.
Can you hear us, Stella?
Stella, they answered it already.
Oh, it's been answered already. Thank you. Okay, moving on.
The answer is yes.
Oops. Oh, excuse me. If you are asymptomatic, why would you need to take the vaccine?
Because you can still be a carrier and pass on the infection.
And I think it's important to know that there are many people now, I've seen certainly in hospital, who've come in asymptomatic, have not had symptoms, but have come in with other illnesses and have actually been tested positive for COVID because they weren't aware that they actually had COVID.
Thank you. Why in African and Caribbean countries are mortality rates low?
Can I just, because I belong to a different panel and this question has come out so many different times, there are issues around the testing that is going on because people are asked to pay. In England, we go to get our tests for free, and in some countries where they have to carry out the test, the actual amount that is charged for a test is actually more than the monthly wage of somebody, and therefore many people don't do that. There's also the issue of underreporting because in a very rural area when somebody dies, they're not going to carry out a post-mortem, they're not going to carry out a test, and so people are buried without actually carrying out any tests. There is also the issue around denial. In certain countries, it's a taboo subject for you to admit that you're COVID positive. It's easier to say you've got malaria or typhoid than it is to say that you are carrying the virus. And therefore, people, even after they've gone for a test, still come back denying that such a thing existed. And so those things become an issue. People are dying, people are carrying the virus, people are suffering, but there is a huge underreporting, undertesting, and a huge denial issue that they need to confront.
I think I'll also add to that I do agree that there is less COVID in African countries than here. In terms of all the reasons why, we don't understand. But Pastor Damien has just been saying that there is definitely underreporting all the things that is said. Like I just put an anecdotal story there. So we're having a conversation with one of our relatives, and we were speaking to somebody back from Nigeria, and they were saying that actually that so many people are dying and everybody is sick, but they don't call it COVID. Now we see people that say they've got malaria, but they've got breathing problems, and normally you do not get breathing problems with malaria unless it's severe. And so there's definitely all the things that Pastor Damien has said, underreporting, denial, is a taboo subject. It's higher than people say it is, but it's not as high as here.
Thank you very much. We're coming to the end of the session. I will just ask a few more questions that have come in live, and if we come across any that have already been answered, then I'll just skip over those. Okay. I would like some information on how the Pfizer vaccine could impact me having children later on in my life, because I've been reading stuff about it potentially having an impact on me and other females. I do believe you have answered a question regarding the effects on pregnancy, but I don't know if anyone wants to say any more on that.
It doesn't affect your fertility. It does not affect your fertility in any way.
Thank you. The government is not taking responsibility for the side effects that does not instill confidence.
Can I add something to that? I think it's one thing. Of course, there's lots of information about what government does and what government doesn't do. As physicians, as healthcare providers, quite often people ask us, what would you do for yourself, or what would you do for your loved ones? I said, we're not really here to push a government agenda, we're not here to push any form of propaganda. We're kind of just giving you our own candid opinions, you know. I think every one of us here probably has had at least the first one, and we want it for our mothers and all our relatives that were eligible to have it done. So, you know, I wouldn't intentionally harm myself. So I've made my decision based on my understanding of what I've read before giving it, having someone give it to me. So, there's often a separation between governments, care providers, and people, and I think that's one of the functions of this platform, in which you can see us as normal people just talking to you, people trying their best to look after our communities, and that's all we're here to represent.
Can I just add something there, Stella? And it's to do with an earlier question around having a balanced discussion. I think that in this discussion, we also need to kind of discuss the whole issue around respect. There are people who do not want to take the vaccine because, for one reason or the other. And I, as a pastor, would respect their positions, even after they've been given the full information. I think it is wrong, however, to make a decision based on misinformation, myths and lies. And I think that if somebody is going to make a decision, they should base it on facts, which is why we're here to answer the questions as much as possible. I think also that no matter what anyone's theological position is, we should not make people who have taken the vaccines in hospitals, nurses and doctors, feel as if they now belong to the Antichrist camp, and therefore other people attack them, because I have heard such things happen. It's good that they have all taken one shot on the vaccine or two. I haven't even come as close as being invited to take it, but I would jump at any offer tonight. If I'm called immediately now to go and take my vaccine, I'll just walk away from here and go and take it. That's how much I believe in it, but I do respect people who are not at the same position, and we need to continue to live together in harmony, whether we agree with taking it or not taking it. I think that message is very important. But the overall message here, overriding message is please, I don't want my people to be victims. I don't want the BME community to lag behind in taking the vaccines to the extent that everybody else will get their immunity, and it will be us, doctors, nurses, caring for our own community, pastors, being called to conduct funerals on a weekly basis. I saw that in the 80s, early 90s with AIDS, as my colleagues, especially from East Africa, conducted weekly funerals of members of their congregations who died. And so I don't want to see a repeat of that, and our appeal here is for people to make an informed decision and do what is right.
And I think I would just like to add to that, for me as a nurse, I don't want my family to die of ignorance. I don't want anyone to die of ignorance. And I think there is a lot of fear in the community, a lot of fear in the black community, and that has been generated on social media by misinformation. And I'm not here to dispel that there is real fear, that people are concerned, they do have anxieties, and I think the way round that fear and anxiety is to actually be informed, but to be informed accurately, to read the information, to ensure that when you're making a decision to say you're not going to have a vaccine or you're going to have a vaccine, that it's based on accurate information and not just on hearsay, and not just on your neighbour saying, well, I'm not having it because that person down the road, they knew somebody that had it and they've now turned into a dog. So, your information should be based on facts, not just on hearsay. In the same way that, if you're going out to buy, some perfume or something to eat, you base it around information that you feel is sound, and this should be absolutely the same thing.
Thank you very much. Thank you very much. We're going to wrap up shortly and end with a poll. Before that, I'll just ask a few more of the questions that have come in live. Is the medication taken into account when given the vaccine? Are certain ones given to those with allergic reactions to penicillin, which will cause anaphylactic fits? So medications being taken into consideration.
Yeah. So when you go to the vaccination centre or your surgery to have the vaccination, you will be asked. You'll be asked about your medical history, about certain medications, especially blood thinning medications. So there's certain things that they will ask, and they'll make sure that it's appropriate for you. So at the moment, it's not everyone who has an allergy who is exempt from it, but if you've had a history of allergic fits, so this means anaphylaxis, you've been very unwell, needed hospital admission, and you carry an EpiPen, there are certain vaccines that you won't be able to have, but you'll be screened according to your personal medical history, medication, and you won't be given a vaccine that is unsafe for you.
Thank you very much. And I'll just take a couple more and then we will take the poll. What is the best solution for everyday people to not fall for conspiracy theories or fake news around the vaccine?
So I think the best thing is that people need to read information from trusted sites. So government.gov.uk is an excellent site. There is lots of information there. It breaks it down. I think what people need to not be doing is reading complex information that actually they don't understand, and then they actually make theories out of that information because they don't understand it. So there is lots of trusted, tried, tested, accurate information out there, and if you still are unclear about whether you should have the vaccine, you need to get yourself informed. You need to get information that is sound, that is solid, and that is accurate. You need to go to a trusted site, not just look at WhatsApps that's been sent round, that's misleading, that's giving misinformation, and that is scaremongering. I think it's really important that as black people, as communities, we owe it to ourselves to be informed. Please don't die of ignorance. Get the right information. Get accurate information. There are doctors, healthcare professionals, you can ask them. If you've been invited for a vaccine by your GP, by your healthcare provider, and you need more information, then ask. ask for that information. Don't just say no based on, you know, what someone else has said, because your condition, your underlying medical condition is going to be different to your neighbour's. You know, your neighbour may be taking medication for their blood pressure, and so might you, but they could be completely different things. So you need to get the information that's based around what is right and appropriate for you, not for someone else.
Can I add to that? There's so much misinformation out there, and if you are out to get information, people will send them to you. And there needs to be some kind of discipline to say, I've had enough, I'm not going to listen to, especially those video clips that you can't make out the name or the face of the person, and you've got to go from one to another. And people need to really be well informed that there is so much misinformation out there, and there are people who make life extremely difficult for other people by sending out information that is not correct. I guess that this is where I agree with what you said. We go to trusted sources, we go to our doctors or our nurses. One of the things that has really inspired me, I was one of those that in one of the first panels, I listened to one of the guys from my place who was involved with the Pfizer vaccine in America. And I asked him direct questions. And what gave me confidence is that we now have our own sons and daughters who are in the medical field, who are in the pharmaceutical industry, who are scientists themselves, and who know how to decipher information. If I can trust my children to help me, and they still do, set up my new phones, every time I get a new phone, I just pass it on to them to try and sort me out. I think in the same way we can rely on information that has come from trusted sources, like people here on the panel, and that will help us to move away from misinformation.
Thank you. Thank
Stella.
you very much. Did someone just call me?
Yeah, I was going to say, just to answer some of your questions quickly, because I can see you scrolling through. One, there's the vaccine has not been made with aborted fetuses, and there's no pork within it.
Thank you.
And it says, is it to do with vitamin D deficiency? Look, we've been telling people from time memorial, take your vitamin D. It's nothing to do with your vitamin D, but we do recommend it, especially during these winter months. And with regards to if you're going to need the vaccine, if you're going to be stopped from doing things, I did hear that Pimlico plumbers told their workforce that they have to have the vaccine. I don't think this is fair, but we cannot stop individual employers from making their own decisions about what they want to do. But just like yellow fever, there may be certain countries where the vaccine may be compulsory, and that is, again, not new.
And I just want to also say that, you know, some of the things that I know people have said to me is when you go for the vaccine, you know, you're forced to sign some indemnity clause to say that, you know, you won't report side effects. That is absolutely false. That is not true. Having the vaccine is an informed choice. You know, you make that choice. You're not forced to sign to say that if anything happens to you, you won't report it, or that if anything happens to you, you're not going to, you know, sue the government or sue the NHS. All those things I can absolutely assure you and say they are false. You make an informed choice, an informed decision. No one is forcing you to have a vaccine. If you're invited to have a vaccine, it is your choice whether you go and have that vaccine or not.
Thank you very much. I think on that note, we will close this part of the Q&A.
Hold on, Stella. Stella.
Hi.
So sorry, Stella. I've had to quickly jump in because there's a couple of more people that are asking questions, and I'm asking everyone if you can just give us 3 to 4 more minutes. If you can just give us 3 to 4 more minutes, because there's a couple of other questions that have just come through, Stella. And I have to ask this tremendous panel, are you guys okay?
Okay.
Can you, those that are watching, do you mind just please keeping your hands together, put your hands together for this tremendous panel. They're answering questions, but they're doing it literally live as we speak. Thank you so much. Thank you so much. Quick fire answers. So we're going to do, Stella, we're going to do a quick fire answers. 3 minutes quick fire answers to the panel. And I'm going to start with Reverend Luke. The question was asked, should the churches be open, Pastor Damien? In your opinion, considering that we're still going through a pandemic, I've got a message here on this phone from one of the guy in the jerk shop, and he's asked, should the churches stay open?
You made me feel hungry now. Maybe I should drive through one of them. Church is a place of worship, is a place where people go to when they feel down, they need to call on somebody, they need support, they need prayers, and yes, I believe that churches should stay open. However, I believe that it should be done, that churches should follow government guidelines. This pandemic is evil. The virus is evil. I don't think that churches should go back and do things that they used to do before. I think that they should take certain measures, make sure that people wear masks and follow government guidelines. In Praise House, we haven't been meeting and we're not going to meet for the foreseeable future until we are sure that people are safe. I have a duty of care, not just to myself and my family, but also to the people that God has given to me to make sure that they're well, they are safe. God is not going to smack us because we haven't met.
Can we just say that churches are open online, everywhere? Just because we're not in a physical building doesn't stop us being Christians, so let's just not think that church is just a physical location. Amen.
Next question goes out. One of the people have just sent in a WhatsApp message, they've said, how can you be sure the vaccination is going to work when it hasn't been tried out on people that have already got underlying health conditions? So how do you balance it out? How do you see the effects if somebody's suffering with diabetes and it's not been offset against that? That's a question that's just been sent through again on WhatsApp.
That's a fantastic question. I would answer that quickly. It actually has been tried out on people with underlying medical problems. So if you look at the Moderna data and also some of the other studies, they tell you the proportion of people that's got diabetes, proportion of people that are immune suppressed. So it's been tried on people that have got low immunity, HIV, immune suppressive drugs, and other conditions. It has been tried out. The data is all there. You can go on the company website and the data will be available to break it down for you. So you can check it out.
So you're saying that people with lupus, people with sickle cell, you're saying this vaccination has been tried out
it has been tried
on people that have got underlying health, because another concern, another question's come in, that how comes when people go into Croydon University Hospital or St George's or some of the local hospitals and they've got high blood pressure, they automatically end up on a ventilator. People have got concerns and worries about that. Then ask me to ask you.
But even people without any underlying conditions are now ending up on ventilators. That is the problem. That is the problem.
Yeah, I mean, I absolutely would dispel that. So I think, I've been in St George's Hospital from the start of COVID. I have had no time off. And I know that people who are coming into hospital genuinely unwell are coming in with a myriad of conditions. So as I said, part of my remit is that I look after patients with cancer, with kidney failure, with sickle cell, and patients who've got many other serious conditions. And so those patients that are coming into hospital, they're getting treatment and they are being treated. It's no different for somebody when they come in with COVID. You can come in with a simple cold, get sepsis and end up on a ventilator, nothing to do with COVID.
Okay, because there's one more concern that was thrown out, was that how comes it seems that people go into the hospital with a headache or they go in with some kind of, and then automatically they've got COVID-19? No, but I'm dealing with the next.
Everybody knows people who go in will get this.
Yeah, so I've been saying for ages, what happened just before the second surge spiked, lots of people were coming into hospital with no symptoms of COVID, but when they got to the hospital and we tested them, they had COVID. So a lot of the COVID was incidental because people were not displaying symptoms, and I've been saying this for ages to lots of my colleagues and friends. So, you could come into hospital with a stroke and have symptoms and didn't know you had symptoms, didn't know you had COVID, but because we have to test everybody that comes through A&E, that's how we were picking up many patients coming through the front door with COVID, because they were coming not with symptoms, coming with other underlying conditions, We have to test them to see where we're going to place them, and in doing so, we were picking up more and more patients with COVID. That's how the hospitals got saturated so quickly. Not because people were coming in with COVID, they were coming in and we were discovering they had COVID.
And once we've discovered that they have COVID, we have to treat them accordingly, which means that you can't then treat someone that has a stroke, for example, on a normal stroke ward. You now have to put them in a group of people that also have COVID just to try and reduce the spread of infection. I think it's really important.
Do you understand though? Do you understand why that little part there is what the 550 viewers are asking about? How comes my aunt went in with a stroke and then she died of COVID? They're asking, that's the question. And in that answer what you're about to give, that's where I suppose trust may be brought. It may bring some reassurance, understanding, clarity, because I can give one instance where my close friend, the last time his daughters saw him was when he went into an ambulance. Okay, and till this day, from he went into an ambulance in April, he's not been seen because he's in the grave, and between there and the grave he's not been seen again. So how do you offer that reassurance to that part? Thank you.
In the first way, when we were not testing,
yes,
I still stand by this, that a huge proportion of the population, a lot of us got COVID and we didn't know it, right? So, you know, people like me, for example, at some point, I never tested positive for COVID, but when I tested for antibodies, I had antibodies, which meant I caught it at some point, right? So we have to appreciate that a lot of people are going to get COVID, a lot of people are going to be asymptomatic, but there are still genuine medical problems and medical emergencies that are going to warrant treatments. But because a huge proportion of people are going to be asymptomatic, when we do test them for it, it's going to coincide. So I think we have to still try and tease out those two things. And unfortunately, I think COVID and COVID variants are going to be something that we're already starting to learn to live with it. But we just need to make sure that we're appropriately informed in terms of the strategies that we're going to use to combat it.
I think you guys are fantastic. Honestly, I'm so grateful. Stella, what's going on with the poll?
If you're ready, we can move on with the poll. Thank you so much to the panelists for your answering these questions, and thank you to everybody that's tuned in and has submitted questions. Really appreciate your time, all of you. We will move on with the poll. Okay. How likely are you to take the COVID vaccine? How do you feel about it now after having some of your questions answered? Has it changed your mind?
43% is unlikely. It's gone up from 21.
Okay, so... Okay.
36 is unlikely.
So similar results to the start, actually.
Wow.
Okay, so yeah, 35% say likely, 34% still unsure, 22% unlikely. Okay, so 2% more people are unsure than those who are likely to take it, and 23% unlikely.
Stella, can I ask a question?
Yes, of course.
The question I asked the crowd is, how many of you feel now more informed based on this discussion with the doctors?
That's what's really important.
Because for me, it's about people being more informed so they can make informed choices. So do you mind in the chat, can you just respond with whether you feel more informed or not?
Anthony, somebody's asked in the chat if you could stop shouting.
Sorry. You know what? In the chat, I'm so sorry for shouting. This is the problem with us people from Croydon, you know, especially from the beautiful part of the borough, South Northern Lakes. That's the difference with us. We have to project our voices slightly. While they're doing that and responding, Stella, I want to salute Sarah Jones, Andrew Brown, yourself, Stella. I want to also salute these tremendous panelists. Stella, you're incredible as always. Valcon, AJ, you guys are incredible. We want to salute Rachel. I saw Rachel Flowers in the chat. Thank you, Rachel, for being in the chat. Dr. I can't say her name. It's a beautiful name. How does it?
Nana Asuji.
Nana Asuji. You are a boss. Also, I saw a lady, Michelle, in there typing and putting in some tremendous responses. Doctor, I think he's a doctor. I'm putting in tremendous responses. Pastor Beryl's in there, Sabla, TCC. I see so many people up in there. Lisa from, Lizzie from ARCC. The chat is hot.
I was just going to say, I think it's just really important for all the talk that we're talking, that I've received too many phone calls from people when it just feels too late, when they've become unwell and they haven't gotten to hospital. So no matter how you feel about the vaccine, please, we beseech you, don't sit at home feeling breathless, wondering if you need to speak to your GP or a doctor. Call for help, please.
Thank you very much. Thank you very much all the panelists. Thank you everybody that's taken part. Thank you everybody that has tuned in. Anthony?
We're going to send over to Andrew Brown. Ladies and gentlemen, we want to thank you for your time. Andrew Brown, close us off. Hey, you guys, outstanding. Reverend, John, Marley, Dr. Damien, Dr. Sydney.
Thank you. Thank you, Anthony King.
No.
If you please put yourselves on mute. Thank you, doctors. Thank you so much. I really appreciate you coming all the way from Stanford and all around London as well. Spending the last 2.5 hours with us. I have got your food in the kitchen, okay? So I've kept my promise to make sure I'll feed you for coming down and spending some time with us. Can I just please say a big thank you to my team as well. Lizzie, thank you. Tracy, thank you so much. Melissa, thank you for spending the last 3 hours with us. Stella, thank you so much.
Yeah, my wife didn't want to have it until I did the ITV program.
Also,
Yeah, I just